This patch of shade is a small reprieve for Lise Burnett.
It's closer to 30 degrees in the apartment.
She lives in a private seniors home and has multiple sclerosis. The air conditioner in her room isn't installed yet, and cooler common areas are off limits because of COVID-19.
Usually we go in the shopping center, but they're closed too, so there's nothing really we can do.
At the long-term care home next door, more than 50 people have died from the virus. Residents still can't leave their rooms, but the owner says things are now under control, and he's confident they can deal with the added risk of the heat.
Some clients, they'll need some more fresh air, so we're going to install air conditioning, portable air conditioning in their room.
But not all long-term care residents have access to air-conditioned rooms. While most public homes have cool, common areas, advocates say that's not enough, particularly now that some of those spaces are closed.
This is inhumane, irrespectful. These are not animals that you put out together in a cage.
The province says it's working on solutions.
Not only for resident and vulnerable people, but also for working people that have to work in a very difficult conditions with their mask and their gloves and their blouses.
Outside the homes, the heat is complicating the COVID-19 response. This mobile testing site closed for the day over concerns staff and those waiting to be tested would overheat. With water fountains, pools, and libraries closed, community groups say vulnerable people have few options left to cool off.
As hard as it normally is to get away from the heat, right now it's nearly impossible.
The city says splash pads are gradually reopening as public health officials figure out ways to deal with a double risk, high temperatures on top of a pandemic. Alison Northcott, CBC News, Montreal.